Judah, I have permission to record you for my online Dr. Athletic training course, corrective exercise techniques for movement dysfunction?
Yes.
Scoring the right side rotary stability test, we're looking for the elbow and knee to come together over the board, not losing his balance and able to perform the repetition. That second rep right there looked very good. I would have scored that a 3 right there and actually stopped the test, so he wouldn't have actually performed the third repetition for me on that. The left side scoring now. Has a hard time starting off that first rep. I wouldn't accept that first rep. I'd make him do it again. Hard to see on this video. More of a right shift here. The ankle also moves into an inverted and plantar flex position. Hard for you to see on this angle. So he would definitely not get a 3 on this. We'd have to move him into the 2 position. I did want to show you the test from the side view as well. So again, right side, fairly clean. He could go a little bit slower, but that second rep is actually very good. This is one of the better FMS rotary stability tests that you'll probably see from a patient. Left side, notice the difference here, how hard it is for him to get into that left hip extension position. Harder for him to balance. And he wants to really flex the knee to try to get into extension. So a lot of compensation here. So we're definitely going to move him out of the unilateral and make him perform a diagonal repetition for the left side. We'll show the right side first just to show you. He got a 3 on this, but easily gets a 2 here. Left side, much better, much easier for him. So he would get a 2 on the left, 3 on the right. Looking at the supine position, I wanted to incorporate some rolling patterns. This is something that I don't do a lot in clinical practice, so still something that I'm working on getting used to. But as we're looking at the supine to prone with the upper extremity, first thing I notice is the lack of neck initiation, neck flexion. We'd like to see that neck kind of lead with that arm as he goes over. Move into the lower extremity here. He moves into his second rep. He starts to incorporate the upper extremity before he even takes the lower extremity over. So for this one, patient probably could have used some cueing and probably could have cleaned this up a little bit. But for the sake of the video, I did not cue him because I couldn't decide if I wanted to use this as my assessment or as actually an intervention for the video. So moving to the other side again, no neck initiation, no neck flexion. It doesn't follow the upper extremity as it leads him through. He does kind of kick down here a little bit with the lower extremity to push himself over. So for him, again, I'd like to do this as some cueing, but not a bad start to use rolling as an intervention for this patient. And again, same thing on the other side. He initiates that upper extremity. Some supine trunk rotation progression. Medicine ball straight overhead, ribs down, cueing the patient to breathe normal. Feet flat, and we're just kind of rocking side to side. I don't want them to lose contact with that thoracic spine on the floor. Good control, nice and slow. This patient's actually performing this exercise very well, as I would like him to do. As this progression gets easy, the next thing we can do is actually change position, alter the task a little bit, and I'm going to move him into a 90-90 position. So he'll rotate to the left, rotate to the right. Notice there that you see the knees kind of separate as he moves too far. To correct this, you could just have him not move as far, or put something between the knees to kind of cue them to stay together. So for the sake of this video, we're going to add a softball to this patient just to help him not lose that separation a little bit. Notice here he kind of cleans that pattern up by himself just by having that that little bit of intervention. Good. Great core stability exercise with rotation. Requires abdominal bracing to complete this exercise appropriately. Once this gets easy, another progression to this is actually to lengthen the moment arm and just kind of increase the load. So we would actually have him extend the knee here and perform some rotations. Anytime we're kind of increasing that load, I obviously want to be careful and make sure that they're using correct form, not performing too much, not putting too much stress through that lower back. So again, watch form very closely if you're going to perform this exercise with the knees extended like that. All right, here we've placed him in the half kneeling position. We're going to look at some external rotation of the shoulder. Again, all rotation doesn't have to go through the torso, so we're just going to show you some shoulder external rotation in the half kneeling. Notice his left hand on his rib cage, helping him stabilize, really activate those left abdominals as he comes back. We're going to move the tubing into different positions, so this is a great way to also alter the task, is just create a different angle for them to pull through. Here again, advancing from the shoulder external rotation, we can integrate some P&F patterns here. D2 flexion, initiate a more difficult task. The one thing that I would correct him here is to have his head, eyes follow his hand as he's performing this exercise. That would be one correction that I would make here with him. Next, we're going to look at the diagonal cable chop. Here we're using the rope as the attachment on the cable machine. You can use this with the straight bar or the rope, either one. This one just makes it a little bit difficult. But here the focus is on the breathing. So you'll notice as he gets to the bottom of the chop, he's taking an inhale and exhale, pause, going through one breath cycle before he returns to the start position. This is a great exercise to incorporate some rotation activity, but also focus on some core stability and some diaphragmatic breathing as well. All right, advancing our postures into the standing position. Now we're going to do a lunge with rotation. He's actually going to initiate the rotation piece as he moves into the lunge position. Notice that he's not stepping too far. He's not losing control. I really want to make sure that they're not going into any excessive lordosis here in the lumbar spine. He does a good job controlling that as he leads with his right leg. Notice he's got a little tougher time coming over the left leg here. If we go back to our FMS rotary stability test, obviously some asymmetries with this patient, so we would need to do some further assessment on him. Next, we're going to do a deadlift to rotational press. This works great with if you have a landmine. I'll show you what that is next, but notice he comes down into the deadlift position, moving up into rotation. He twists off the back foot as he goes back, and he uses the deadlift to actually assume the starting position. He's not leaning over and just kind of dropping the weight down. Again, great exercise. For the sake of the video, we didn't have the landmine, so we did not weight this exercise, so we're just using the barbell. But the landmine, you can see it's a tube, allows you to stick the barbell in there, add some weight, and control that. Great exercise. Here, looking at some standing rotation med ball throws. Here we're using a single arm push. You can do this double arm to make it a little bit easier. Or for this case, if you want to focus on one side versus the other, this is a great exercise. Moving here to the overhead slam, he's going to rotate and alternate left to right. Good abdominal bracing as he runs through this. He's not losing his position. Kind of holds his breath a little bit here. I'd like to kind of see him maintain a little bit better breathing pattern as he's doing this. Finally, if you're looking, another progression from the single arm push toss is add a dynamic piece to it. So for here, we're going to have him just do some lateral movements left to right before he makes his throw. So here, good starting position, left, right, and push.